Have you been told that your ball of foot pain is just something you'll have to live with? Maybe you've tried padding, different shoes, even injections, but the pain keeps coming back. If you're dealing with persistent pain behind your second toe, or if you feel like you're walking directly on bone, today's module is going to change everything for you. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas, with over 25 years of experience treating foot and ankle problems. Welcome back to our Ball of Foot Pain 101 series. Today we're focusing on two conditions that are often overlooked but can be absolutely devastating to your quality of life: capsulitis and fat pad atrophy. More importantly, we're going to discuss how to fix these problems at their root cause, not just mask the symptoms. We'll explore cutting-edge treatments like liposana fat grafting injections and other regenerative therapies that can actually restore function of your foot, not just provide temporary relief. Before we dive into these advanced treatment options, I want to remind you that I've written a comprehensive book all about ball of foot pain that covers everything we'll discuss today and much more. You can get it completely free at www.balloffootbook.com. Also, if you find this information helpful, please like this module, hit the subscribe button, and share it on social media. This helps others who are struggling with foot pain find the relief they need. Let's start by really understanding capsulitis, because this is a condition that's often misdiagnosed and dismissed as just general ball of foot pain. Capsulitis is inflammation of the joint capsule, which is a collection of ligaments that surround and support each toe joint in the ball of your foot. Think of the joint capsule as a sleeve that wraps around the joint where your metatarsal bone meets your toe bone. This capsule is made up of strong ligaments that provide stability and keep the joint properly aligned. When these ligaments become inflamed, that's capsulitis. The most common location for capsulitis is under the second toe joint, though it can affect any of the toe joints. The second toe is particularly vulnerable because of its position and the way forces are distributed across the foot during walking. Now, capsulitis doesn't just happen randomly. There are specific mechanical reasons why this inflammation develops, and understanding these causes is crucial for effective treatment. The most common cause is something called equinus. This is a condition where your calf muscles are too tight, preventing your ankle from bending upwards adequately. When you can't bend your ankle properly, your foot compensates by putting extra pressure on the ball of your foot, particularly under the second joint. Abnormal foot mechanics also plays a role. If you have a bunion, for instance, the big toe joint becomes less functional, which shifts more pressure to the second toe joint. If you have a long second toe, known as Morton's toe, that also increases the pressure on that joint. Previous trauma can trigger capsulitis as well. Maybe you've stubbed your toe or dropped something heavy on your foot. Even if the initial injuries seem minor, it can start a cascade of inflammation that can lead to chronic capsulitis. The symptoms of capsulitis are quite specific. Most patients describe feelings like they're walking on a marble or a small rock, specifically located right behind one toe. The pain is usually very localized and gets worse with weight-bearing activity. Unlike a Morton's neuroma, which causes burning or tingling, capsulitis typically causes a deep aching pain. You might notice swelling around the affected toe, and the area is often tender to direct pressure. One of the most concerning aspects of capsulitis is what happens if it's not treated properly. The persistent inflammation can actually cause the supporting ligaments to weaken and stretch. Over time, this can lead to the toe starting to drift towards your big toe or even crossing over it. Once this happens, the condition becomes much more difficult to treat and may require surgical correction. Now let's talk about fat pad atrophy, which is another major cause of ball of foot pain that's often overlooked. Remember that natural cushion I mentioned in the previous modules? The fat pad under the ball of your foot serves as your body's built-in shock absorber. When this fat pad thins out or deteriorates, you lose that crucial cushioning. Fat pad atrophy can happen for several reasons. The most common is simply aging. As we get older, the fat pads in our feet naturally thin out, just like they do in other parts of our body. This is one of those unfortunate facts of getting older that nobody really talks about. Long-term overuse can also cause fat pad atrophy. If you've been a runner for many years or your job requires you to be on your feet on hard surfaces all day, the constant impact can gradually wear down your natural cushioning. Previous steroid injections in the area can also cause fat pad atrophy. While steroid injections can be helpful for reducing inflammation, one of their side effects is that they can cause the breakdown of fat tissue. This is why I'm very careful about how often and where I use steroid injections. High heels are another major culprit. When you wear high heels, all your body weight gets shifted forward onto the balls of your foot. Over time, this constant pressure can cause the fat pad to break down. The symptoms of fat pad atrophy are quite distinctive. Patients often feel like they're walking on bone or have deep aching pain that's worse on hard surfaces. The pain is usually more generalized across the ball of the foot rather than localized to one specific spot, like with capsulitis. You might notice that the skin under the ball of the foot looks thinner or more wrinkled than it used to. Sometimes you can actually see the outline of the metatarsal bones more clearly than before. The pain from fat pad atrophy is typically worse when you're walking barefoot on hard floors, and it often improves when you're wearing well-cushioned shoes. Many patients tell me that they can walk around their house barefoot anymore because it's just too painful. Now let's talk about treatment approaches, starting with conservative options before we move on to more advanced regenerative treatments. For both capsulitis and fat pad problems, padding and taping can provide significant relief. Metatarsal domes are small dome-shaped pads that you place just behind the ball of your foot. They work by redistributing pressure away from the painful areas and can be very effective for both conditions. For capsulitis specifically, I often use a taping technique that supports the affected toe and prevents it from flexing upward excessively. This gives the inflamed joint capsule a chance to heal while maintaining proper toe alignment. Toe support and correction devices can also be helpful, especially if we're dealing with hammer toe deformities that are contributing to the problem. These devices help maintain proper toe alignment and reduce stress on joint capsules. Custom orthotics are often essential for addressing the underlying mechanical problems that cause these conditions in the first place. For capsulitis, we designed the orthotic to redistribute pressure away from the affected joint and address any biomechanical abnormalities like equinus or overpronation. For fat pad atrophy, we can add specific cushioning materials and metatarsal bars to the orthotic to help replace some of the lost natural cushioning. The key is creating an orthotic that not only provides symptom relief, but also addresses the root mechanical causes. However, while these conservative treatments can be very helpful, they don't restore the damaged tissues. They manage symptoms and prevent further damage, but they don't fix the underlying problem. This is where regenerative treatments come in. Let's talk about one of the most exciting developments in treating fat pad atrophy, liposana fat grafting injections. This is a revolutionary treatment that can actually restore the natural cushioning to your foot. Liposana is a processed fat graft material that's derived from donated human tissue. It's been specially prepared to maintain the structural properties of natural fat while being safe for injection. These procedures involve injecting this material directly into the areas where your natural fat pad is thinned out. The procedure is performed right in the office under local anesthesia. I sometimes use ultrasound guidance to ensure precise placement of the liposana material exactly where it's needed the most. The injection itself takes a few minutes, and most patients experience minimal discomfort. What makes liposana so effective is it doesn't just provide temporary cushioning. Over time, your body incorporates this material and it becomes part of your natural tissue structure. Studies have shown that cushioning effect can last for years, and many patients experience permanent improvements in their symptoms. The results with liposana have been remarkable. Patients who haven't been able to walk barefoot for years are often able to do so comfortably within a few weeks of treatment. The deep aching pain that characterizes fat pad atrophy typically improves dramatically. For chronic capsulitis, we also have excellent regenerative options. Platelet-rich plasma, or PRP therapy, has shown outstanding results for this condition. PRP uses your body's own natural healing factors to reduce inflammation and promote tissue repair. The procedure involves drawing a small amount of your blood, processing it to concentrate the platelets and growth factors, and then injecting this concentrated solution directly into the inflamed joint capsule. The growth factors in PRP help to reduce inflammation and promote healing of the damaged ligaments. What's particularly exciting about PRP for capsulitis is that it can actually help to strengthen the weakened ligaments, potentially preventing the toe deformities that can develop if this condition is left untreated. Many patients experience significant improvement after just 1 or 2 treatments. We also use other regenerative treatments like laser therapy and shockwave therapy for these conditions. Class 4 laser therapy can help reduce inflammation and promote tissue healing at the cellular level. Shockwave therapy uses acoustic waves to stimulate blood flow and promote natural healing processes. The key with all these regenerative treatments is that they're working with your body's natural healing mechanisms rather than just masking symptoms. They're actually helping to repair and restore damaged tissues. Now, I want to be clear that not everyone is a candidate for these advanced treatments. We need to do a thorough evaluation to determine which approach is the most appropriate for your specific situation. Factors like the severity of your condition, your overall health, your activity goals, all play a role in treatment planning. For some patients, a combination of treatments works best. We might start with PRP for capsulitis, then add liposana injections for fat pad restoration. Or we might combine the regenerative treatments with custom orthotics to address both the tissue damage and the underlying mechanical problems. The timing of treatment is also important. These regenerative therapies tend to work best when used relatively early in the disease process. If we wait until there's severe structural damage, the result might not be as dramatic. That's why I always encourage patients not to tough it out when they're experiencing ball of foot pain. The sooner we can intervene with appropriate treatment, the better the outcomes tend to be. Let's talk about what to expect with these treatments. With liposana injections, most patients notice improvement within a few weeks, with continued improvement over several months as the material becomes incorporated into your natural tissue. The procedure itself has minimal downtime. You can usually return to normal activities within a day or two. With PRP treatments, this timeline can vary. While some patients notice improvements within a few days, most take several weeks to see the full benefit. It's important to understand that these are not quick fixes. Regenerative medicine works by stimulating your body's natural healing processes, and that takes time. But the advantage is that the results tend to be long-lasting because we're actually repairing the damaged tissue rather than just covering up the symptoms. Now, when do we consider surgical options? Surgery becomes necessary when there is significant structural damage that can't be addressed with conservative regenerative treatments. For capsulitis, this might mean plantar plate repair if the supporting ligaments have torn completely. Plantar plate repair is a more involved procedure that requires making a surgical incision to access the torn ligaments. The ligament is then sutured back together and anchored to the bone. The surgery can be very effective, but it requires several weeks of recovery and rehabilitation. The key message I want you to take away from today's module is that capsulitis and fat pad atrophy are not conditions you just have to live with. We have effective treatments available that can address these problems at their root cause, not just manage the symptoms. Prevention is always better than treatment, though. If you've had these conditions treated successfully, there are things you can do to prevent them from coming back. Proper footwear is crucial. Avoid shoes that put excessive pressure on the ball of your foot. Custom orthotics can help maintain proper foot mechanics and prevent recurrence. Regular stretching, particularly of your calf muscles, can help prevent the equinus that contributed to capsulitis. Maintaining a healthy weight reduces the overall stress on your feet, and paying attention to early warning signs allows for prompt treatment before conditions become severe. As we wrap up this third module in our Ball of Foot Pain 101 series, I want you to understand that we now have the ability to actually fix many of these problems at their source, not just manage their symptoms. Treatments like liposana fat grafting and PRP therapy are revolutionizing how we approach these conditions. If you found this module helpful, please take a moment to like it, comment below with any questions you might have, and share on social media to help others who might be struggling with similar pain. Be sure to hit the subscribe button so you won't miss our final module in the series. Don't forget to download your free copy of my comprehensive guide to ball of foot pain at www.balloffootbook.com. It includes detailed information about all the regenerative treatments we've discussed today. If you're currently dealing with capsulitis, fat pad atrophy, or persistent ball of foot pain, and conservative care isn't working, remember that there are next level options available. The link to request an appointment is in the description below. Early intervention with these advanced treatments can often prevent the need for more invasive procedures down the road. Thanks so much for watching, and have a great day.